Hello there and welcome to the video. So, I'm looking at this one from the United States. Is veganism healthy? This Vancouver office, and it's a medical office, tried it for a month to find out. 7 of 8 employees at AIM Medical Imaging Services completed the 30-day vegan challenge. Do you remember January or Veganuary? I'm not sure how it was pronounced, or I didn't take part, no way. I've done vegetarian and vegan diets before, and okay, they're alright, but they're nothing like eating all the meat and like fatty foods that you love, you know, and cream and things like that. They don't compare even in the slightest. So let's have a look at what was involved. At the start of the challenge, each person tested their blood, body mass index, visceral fat, and peripheral fat levels. Dr. Raj Attariwala, who runs the clinic, says he lost 8 pounds, but it was mostly muscle. Makes sense if you ask me. The body needs protein. You can't really get the complex proteins, amino acids that the body needs to build muscle from plants. It's very difficult, close to impossible. That's why virtually every bodybuilder, weightlifter especially, powerlifter especially, rugby player, they eat tons and tons of meat, protein, eggs, protein and fat. So he said, I have to tighten my belt, but I gained fat. He said, I'm a skinnier, fatter guy than I was before. So he's lost muscle, but he's put on fat. Not good at all. So the employees had access to the company's Prenuvo full body MRI scans, which allow them to measure the benefits of their diets in great detail. I mean, this is a really good test if you ask me. Some of the evidence for plant-based foods involve, get this, and these are some of the most cited papers in the world for being able to prove that a plant-based lifestyle and carbohydrate diet is good for you. And that is that they take people from the public, and over the course of the year they send them I think it's 2 questionnaires are used, and the questionnaire says, how much protein did you eat in the last 24 hours? How much fat did you eat in the last 24 hours? How much of that was saturated, non-saturated, trans fat, polyunsaturated fat? How much carbohydrate? How much protein? And they try and ask these people, first of all, they say, well, how much did you eat? And then they prompt them. They say, did you eat any rice? Did you eat any beef? How much beef? You had a pie? How was the pie made? I mean, it's just ridiculous. And based on that, they tell us how to live and eat our lives. Now, the other problem with that I see is that, anyway, it's in another video that I do that's in detail on the lies that we were told about our diet and what we should eat by the government. And basically, what they're doing is they're going out and they're taking a section of people and they're looking at what they eat, and then they're saying, well, those people suffered more from chronic heart disease or obesity or whatever. But those people they're taking are already eating bad diets. The Western world's eating a bad diet. Virtually everybody is. Therefore, you're testing a broken machine to begin with. Anyway, I'll go into that in more detail in another video. So he says everyone lost weight. Most people saw improvements in their blood tests, and visceral fat levels went down modestly. But Attariwala says, however, everyone lost muscle except for one person who started an exercise program partway through the challenge. We see that we're thinner and think we should be healthier, but the truth is we're not, he said. My body was basically sucking energy from my muscles instead of from my fat. The takeaway is that most people found that meal planning was challenging and expensive as well, because it was hard for them to find the kind of protein sources that they needed. So he says at the end, I guess you can call me vegetarian, he said, a vegetarian who eats meat. So there we have it. This is through an MRI test scan to see what kind of fat levels and, you know, the body mass, really, the central body mass of a person. and that is how much muscle they have, density, compared to how much fat they have. And they lost muscle and they gained fat on a vegan diet in just 1 month. Imagine over a year. And the problem is it's been proven that the American dietary guidelines are too expensive for the general population. You have to be wealthy to eat a or a vegan lifestyle, a plant-based lifestyle to begin with, to be able to get access to the kind of, and you have to supplement it as well. If you're on a vegan diet, you're deficient. There are vitamins and minerals that just aren't in that diet, and you have to supplement them, and that costs money. So there we go. Hope you enjoyed the video. Take care and see you soon. Bye bye.